So what we should do if one or two readings are particularly high or low during measurements. So for some operators, they find that when they do the measurements, sometimes they get one or two very high readings or very low readings. So they don't understand why it comes to that. So the possible cause, we have a few possible causes. And the first cause is maybe the probe is moved. Maybe when we hold the probe, we don't hold the probe steady. So when the probe moved, we may get one or two high or low readings. And the second cause is that the patient moves. When patient lie down, maybe the patient inhale and exhale, and maybe patient move their body. So they will get one or two high or low ratings. And the second cause is that patient bracing. Yeah, when patients exhale and inhale, it will affect the results. And then the first cause is maybe the probe touch the edge of the rib. So what we will see when the probe touch the edge of the rib, you will see that for the animal picture, first picture, the steady layers, you see it is very dark. When you see it is very dark, it means that the probe touched the edge of the rib. If you move the probe back to the intercostal space, you see the animal picture, the steady layers, it shows a gray color. But if you touch the edge of the rib, you find it is very dark. So it means you touch the edge of the rib. That is the fourth cause. And for the fifth cause, of course, is the three mode pictures. We need to satisfy the five criteria I just explained. So the solution for this case, if I get one or two high or low ratings, so one solution is that we can notice the problem on the left, and you can continue the measurements. If all the possible cause is avoided, you can continue to do the measurements, and the results will be stable after you stamp on full switch for a few times. So it will be stable. For example, like this one, like this picture. So as you can see, the first two readings, the first reading is 10.4, and second reading is 7.3, 7.6, and it is high ratings. But we continue to step on full switch because for the three mode pictures, it satisfies our requirements. So I continue to stamp, and you can see the result will be stable. So then we will get a very good result. And for second case is that if the continuous fluctuation of readings, so if I stamp on full switch, but I still get a very high varying range of the readings, you have to clear the data, clears all the data, and check the problem on the left to adjust it and make the measurement again. For example, like this one, as you can see, we get the high readings at the first 11 and 7, at the first and second measurements, and then I get some low results, and then at the eighth measurements, I also got the high results. Why? Because you can check the information on the left on the M mode picture. As you can see, the first picture, the M mode picture, we need the steady layers and the gray color, but you will see some white lines from top to the bottom. So that indicates that there's some gas in the propagation path of the shear wave. It means when we do the measurements, the position of the probe is too close to the lung. So there's some air in the propagation path. So in that case, sometimes I get the high result, sometimes I get a low result. And at last, you can see at the bottom, the IQR is 50%. It is very high IQR. So in that case, what we need to do is we may choose the lower intercostal space, try to avoid the lung, try to avoid the gas interferences. So that is a false result. If we get these results, we need to clear the results and start over. And the second case is like this. You can see at first I get the few very small results. We get first is 2, and second result is 5.4, and then I get the very high results. Why? And then you can check the eye mode, the first image picture. You can see it is very dark, and we can't see the layers clearly. and it's very dark. It is not gray, it's almost black. So it means the probe just touched the edge of the rib. So and if the probe touched the edge of the rib, you may get some false high results. Sometimes it's a low result, sometimes it's high. And you can see the IQR for the UAP results, the IQR is 34. And for the stiffness, the IQR is 50. So it means it has a very high result. So in this case, we have to move the probe back to the intercostal space and try to avoid the rib and clear the results and start over. And that is another case. So we need to notice the 5 criterions and the 3 conditions we need to satisfy. And for the obese patients, some operators and doctors asked about how to measure the obese patients. As we know that the position of the liver for different body size is different. So how could we measure the obese patients? I have a picture to share with you. Okay. If you can see the picture as I show, we usually find the liver position when we use the FT machines that we find the liver, we choose the liver position at between the 7th to 9th intercostal space near the midline line. So usually we will find this position. And but for those obese patients, because they have a thicker fat layers, so their liver is located at the higher intercostal space compared to the normal body size patients or thin patients. And the position of liver for thin patients, the position of liver should be, when patient lie down, the position of liver should be above the midline line. And for obese patients, the position of the liver could be on the midline line or below the midline line. So we have some experience about how to measure patients with assets, with fluids, usually some cirrhosis patients. So as you can see from this picture, that the marked areas on M modes, you can see for the patient with assets, with fluids, you can see on the M mode, it might be shown as the black areas. So it might indicate the fluids. So what we should do, so in this case, what we should do is move the probe along the intercostal space, try to avoid the fluid interferences. Try to avoid that part until we can see the correct image as the correct picture as it shows. So it has the steady layers and has the gray color from top to the bottom. There's no black areas or white areas. Those are interferences.
Can you
and for
left?
Sorry?
In case of ascites, can you put the patient on the left lateral position, turn like this to the left side so that ascites will not come in the way?
As for my experience, as we don't suggest to use the side position. But if you want to try, yes, you can. If you can see the good image of M modes, yeah, you can try. But we don't suggest we use. Usually we just suggest the patient to lie down. But for some special case, yeah, sometimes we try the sideways. Yeah, but in sideways, you still have to make sure the M mode picture, M mode and A mode is satisfy our requirements. Yeah, no interferences in it. And for the second case, we can see, you can see it is totally black at the bottom. We can see some layers on the top, but in the middle, on the top is subcutaneous tissue, but in the middle it's liver tissue. But at the bottom, you can see some black areas. So it might indicate the fluid or the edge of the rib. So if the probe touches the edge of the rib, you will also see the black areas. So you also have to move the probe along the intercostal space, or try to avoid that part until you see the steady layers. So, and for some cases, so we have the correct picture for eye mode. Two kinds of eye mode. You can see it's good. The second one, you can see the second picture. It is a correct picture, but for the first picture, you can see at the bottom it has some white tissues. That white tissue is the non-liver tissue. It's not liver. So for some patients, if they have a very small liver, you will see the non-liver tissue. But don't worry, because for our for active probe, it could distinguish the liver tissue and the bottom of the non-liver tissue. So if there's some small non-liver tissue at the bottom, some white tissues, it's okay. But if it has a larger range, larger than this one, we can't do the measurement. Yeah, and that is correct picture because the shear wave for the patient with assets, because the shear wave, we use shear wave to the measurements. For the shear wave, it could not go through the fluids. It could only propagate in the solids. That's why we need to avoid the fluid. We need to avoid the asset. If we measure the position with the asset, we get the results, but the result has no meaning. That's why we try to avoid it. Now for this case, you can see it is I can say it is the obese patients, and this is a clinical case for cirrhosis patients, and you can see that for the M modes, the upper areas is the subcutaneous tissue, and below it you can see the very steady layers. So that's the liver tissue, and we can avoid the liver. We can avoid the fluids, and then we get the good results. But for those patients who really have a great deal of assets, the fluids, so we just don't suggest them to do the measurement because we can't get the good image of the M modes and the A modes, and so we could not, the shear wave could not propagate on it. So we just don't let them to do. But with the small parts of assets, we can avoid. We can have a try. That's how to. Okay. The wrong case. Yeah. So at last, I want to emphasize that for the three, so we have the 5 criterions, and as you can see, if you can see this picture, if you can see this incorrect picture, you will see that in the middle of the eye mode, you can see the white lines. So that one line is the non-liver tissue, and then you can see the black areas. So that might be the blood vessels, and so in that case, you see the A mode. It also curves. So in that case, it is the fourth image of M mode A modes. And then if you do the measurements, if you show the picture like this, you will get the fourth results. So we have to move the probe along the intercostal space, try to find good image and get good results. And for this case, this is a clinical case. If we measure the position, have the gas in the examination pass. So it means the position we choose is on the lung.